1-2.
Доброго ранку, шановні колеги. Ми розпочинаємо.
Good morning, dear colleagues. We start the working day in the Ukrainian Crisis Media Center, and the topic of the first briefing is as follows. The anti-tuberculosis vaccine is available for children, and we have active Minister of Health, Ms. Ulana Suprun, and Ms. Giovanna Barberis, representative of the UNICEF in Ukraine. Ladies, the floor is yours.
Дякую, доброго дня.
Thank you. Good morning. Today we are happy to thank to our international partners of the UNICEF Foundation for the supply of the 2.5 million of vaccines for tuberculosis and BCG to Ukraine. This bulk that arrived last week. That batch that arrived last week was supplied in response to the request of the Ministry of Health based on the state program for vaccination and treatment of and prevention of infectious diseases. The UNICEF procured a lot of vaccines, and representative of UNICEF will describe which medicines which are already supplied to Ukraine and which are planned to be supplied recently by mid of September. All the vaccines which were ordered in 2015, they will be supplied to Ukraine. The BCG vaccines were commissioned to the Canadian producer who produces them in Bulgaria. They are now registered in Ukraine. We have those vaccines on stock in our warehouses in Ukraine. We are ready to distribute them around Ukraine. Very soon they will be delivered to the regions, and soon as they are delivered, you will find on our website full information how many doses were supplied to each oblast, to each region. Then after some days, when the local authorities will distribute it to specific hospitals, you might request for vaccination. This would allow us to revive the routine vaccination program in Ukraine and have this regular program for the next 6 months. And very soon we will start ordering vaccines for the next years. We will cooperate with the UNICEF for procurement of vaccines for the next year. Here we already have the information how much vaccines do we need, and we now are negotiating with the UNICEF. Due to the UNICEF, UNDP and Crown agents, we managed to buy vaccines amounting to 2.2 billion of hryvnia. NGOs and civil society organizations in cooperation with them allowed us to save 90 million of hryvnia, and for the saved money we will be able to procure medicines for children and orphans. Now Ukraine has the lowest level of immunization, and supply of vaccines is very important for routine immunization and protection of children from diseases which could be prevented by vaccines. We still are campaigning against polio, and this month we had 2 cases of tetanus, and that's why I encourage both parents and hospitals to act proactively in vaccination, approach to your pediatrists and vaccinate your children to save their lives and health. We have to raise the level of vaccination in Ukraine up to European level to preserve the lives of our children and to preserve the lives of citizens of Ukraine. Now I'm pleased to give the floor to representative of the UNICEF. Thank you.
Very much, Minister. Good morning to all of you. It's a great opportunity to be here today. I would like to start by spending a couple of words on the context. I mean, Ukraine has, as you all sadly know, the lowest vaccination rates in Europe and among the lowest in the world. According to UNICEF and WHO estimates, in 2015, only 23% of children in Ukraine were reached with DTP vaccine, 22% with HEPV3 vaccine, and 39% with BCG vaccine. Less than 50% of children are fully immunized against polio. All these are, again, not, figures that are not new to all of you, but it is important, to highlight how important it is to improve the coverage rate in Ukraine. So to address the critical shortage of vaccines and other essential medicines during the 2014 and 2015, the Ministry of Health and UNICEF signed a specific MOU related to international procurement. A specific agreement was signed at the end of 2015, and UNICEF was then charged to procure 22 ARV drugs, antiretroviral drugs, and 8 vaccines. These vaccines, 8 vaccines, are all part of the routine immunization calendar for Ukraine. And this is the BCG, the MMR, the hepatitis B, the DTP, the TD. I hope all of these names are familiar to you. DT, rabies, and BOPV. So we have actually covered, the key vaccines that are and were, missing in the country. Of all of these vaccines, 6 were already delivered to the country, and BCG was the last one to be delivered just a few days ago. There are 2 vaccines, one is BOPV and the other one is DTP, that will most probably arrive to the country next week. The flights are being booked as we speak by our supply division. And I would like also to, reiterate that the vaccines that were procured are all WHO pre-qualified vaccines, some of them were already registered in the country, some of them not. They obtained registration. And the current vaccine supplies are sufficient, however, to cover 4 to 6 months of routine immunization needs in Ukraine. There is no then reason to delay the vaccination. I would like to join the minister in voicing the importance of bringing children to be vaccinated in any health facility. It is important to fill the gap as soon as possible. But of course, again, this is the supplies available are covering 4 to 6 months, so it is very important to start, the 2016 procurement as soon as possible, so not to face, another important gap. And we are working already together, as the minister was mentioning, on in finalizing the agreement for the 2016 procurement of vaccines, particularly, and other medicines. So the sooner, of course, we finalize, the sooner we can procure the vaccines before stocks are fully utilized. Again, I mentioned that registration has been obtained for those products that were not, registered in the country. There are still 2 products that are pending registration, and we're waiting. It's our 2 antiretroviral drugs. So we hope to have the registration finalized as soon as possible, so that we can finalize also the delivery of these drugs. I would like maybe just to spend a word on the amount of funds and the cost of these vaccines, and other drugs. The Ministry of Health has transferred to UNICEF Supply Division a total of $24.5 million. And out of this amount, 20.2 were spent, totally spent. There is a balance then for reprogramming of around $4.3 million. We are discussing with the ministry how to reinvest as soon as possible these funds. In both can be, of course, vaccines or antiretroviral or other drugs if considered to be urgent. As a result of the market, competition and procurement in bulk volumes, WHO pre-qualified medicines and vaccines that were procured by UNICEF from generic manufacturers have consistently led to price reductions over the years, and this is why we were able, to achieve, such an important saving. Just to reiterate as well that UNICEF is not making any profit out of this procurement service to the Ministry of Health, to the country. Quite the opposite. UNICEF has matched with its own resources to cover the logistics, in-country logistics, and we have actually matched with $500,000 to enable the transportation, distribution of all products delivered to the country to the regions and thereafter. So we have, I would say, this investment has enabled the government to save further $825,000 from dollars from the state budget, to the benefit, of course, of more, vaccines or antiretrovirals. Well, maybe I will stop here at this point and maybe wait for your answers, for your questions. Just to say maybe a word on the antiretrovirals, that we are ensuring that over 45,000 patients have uninterrupted treatment. The procurement have included also drugs for 3,000 children who previously did not have any access to pediatric formulations. And again, as for the vaccines, we have a $1 million saving that can be reinvested from the 2015 state budget for procurement of additional drugs. We are sure that the progress made on international procurement of vaccines and other drugs can definitely, lead to the restoration of routine immunization program. This is, of course, international procurement, as again, it's important always to reiterate, it's just a temporary measure. And UNICEF, as other partners, are very much willing to support the Ministry of Health to restore, the national procurement system with whatever is needed for that. So it is important to note that this is definitely going to be happening in 2016. But we will be evaluating together, the situation, and we will be working together to the establishment of a transparent and efficient national procurement system. Thank you.
Дякую, колеги. У нас близько 8 хвилин на запитання, тому, будь ласка, лаконічно представляйтесь, ставте своє запитання. Одне питання.
Dear colleagues, please mention your names and question. Vitaly Knyazhinsky, Dane newspaper. Ms. Ulana, of course you are doing very important things for Ukraine. I think this is your first and extremely important, crucial state, which will be perceived very positively in Ukraine. But could you please explain you how a known company, which is called Ravil Model, and which has only 350 hryvnia as the statute capital, had received the was awarded with the contract on construction works in Central Children's Hospital in Kiev. Thank you for your question, but today we have a briefing about vaccines today. I can respond to your question individually because it's not about today's briefing. News 1 TV channel. Do you know the official data about number of patients having tuberculosis? This is the first question. And the second, how the vaccines will be distributed to the regions? Could we prevent a situation when the parents will come to hospital and they will be requested to pay for vaccines? We have the following figures. I haven't got what she mentioned, but exact figures of those who are assumed to have tuberculosis. They not all are registered. So when we supply vaccines to the regions, then each oblast, each region has its responsibility to distribute evenly among hospitals and family doctors. And this is the responsibility of each region. But in our ministry, we have a hotline, and you can call to our hotline when you request for vaccination and you are not vaccinated. Quite often we redistribute or reallocate vaccines for oncology patients, for oncology children patients, for vaccines when the needs in regions change, and thus we redistribute medicines around Ukraine. That's why we need your information to apply directly to the regional authorities, or having got information from you, we can ask them what happened to the vaccines. Inter TV channel, Ms. Ulana, again the question to you. Vaccination, it's good, but serum against tetanus. In Lviv recently we had one case of tetanus, and we had another case of tetanus in Dnipro city. do you request for information from the regions whether they are sufficient in vaccine doses, or how you plan to prevent these situations? We also are very much concerned with the lack of serums against tetanus. Currently, we negotiate with Ukrainian producers about their possibility to produce this kind of serum. On the other hand, we started negotiations with international humanitarian organizations about supplies of necessary serum. Unfortunately, those serum, they are usually cheap, and not all producers in Ukraine are interested in production of the serum, and that's why we now negotiate with international suppliers of the serum. And meanwhile, before we finalize that negotiation, we started negotiations with humanitarian organizations. And a couple of words explaining the disease. The tetanus can happen if children were not vaccinated to prevent this. When the disease happens, you can do nothing. And that's why we encourage parents to vaccinate children. By the end of this month, we will have all the necessary vaccines, and by the end of September, there will be again supply of vaccines, and we'll be able to vaccinate children. Ukraine TV channel, in addition to the previous question, the deficit of anti-tetanus serum is related to the termination of certificates for Russian-produced vaccines against tetanus. And what is the result of your negotiations with the other organizations? We now negotiate with European suppliers of anti-tetanus serum. How much time the supplies of anti-tetanus serum may take? Actually, the humanitarian organizations had already started to supply to Ukraine the serum, and we hope that by the end of the year we will finish negotiations with foreign producers of serum, and we'll try to speed up supplies as soon as possible, and we are ready to provide very favorable terms for them. Thank you. The minibus is waiting for you in front of the Ukrainian house. The address of the vaccine is in Abuhiv, so you may go directly now. In case of additional questions, I have Miss Valentina next.